Greetings, and thank you for inviting me to address the Cord Blood Association at the 13th International Cord Blood Symposium. I wish that I could join you in person today. I've always been a passionate advocate for biomedical research and regenerative medicine, and I knew you would all be talking about some very exciting developments. First, I want to acknowledge a dear friend and top leader in cord blood banking, transplantation, and research, your president, Dr. Joanne Kurtzberg. Joanne and I have known each other for a long time. In fact, I even tried to get her to leave Duke to come to the University of Utah, and I still haven't given up. I commend you all on the creation of the Cord Blood Association, which is testament to a global desire to promote cord blood banking and the use of umbilical cord blood for the treatment of disease and research. CBA's diverse membership of public and family banks, researchers, patient representatives, and others in the cord blood field shows unity and collaboration within this promising international community. Allow me to share some history about my work in cord blood policy. As some of you probably know, my home state of Utah has the highest birth rate in the United States, so I guess it seemed fitting to have the senior senator from Utah lead the charge on creating a federal umbilical cord blood bank program. In early 2003, I met with Joanne, Pablo Rubenstein of the New York Blood Center's Cord Blood Program, and Phil Coelho of Thermogenesis Corporation. We discussed umbilical cord blood therapies as a promising alternative to bone marrow transplantation and how the federal government could help to increase collection efforts. That night, I called HHS Secretary Tommy Thompson, and he agreed to meet with Joanne, Pablo, and Phil the very next day. Staff from HRSA, FDA, and NIH joined us. Secretary Thompson, he stressed that cord blood banks would need to be managed through HRSA and promised to support my legislation as long as I could get him the money. I accepted his challenge and introduced the Bipartisan Cord Blood Stem Cell Act of 2003 to create the National Cord Blood Stem Cell Bank Network. This network would have been made up of qualified cord blood banking centers to prepare, store, and distribute human umbilical cord blood stem cells for patient treatment and research. Now, many people wonder how bone marrow and cord blood became part of the same federal program. In 1986, Congress established the National Marrow Donor Program, the NMDP, which was spearheaded by the late Congressman Bill Young of Florida. Bill was dedicated to increasing the number of bone marrow donors. In 1990, he created the C.W. Bill Young Department of Defense Marrow Donor Recruitment and Research Program. In April 2005, the Institute of Medicine issued recommendations to create a national cord blood network. Those of us in Congress who had been working on cord blood and bone marrow realized that combining our bipartisan bicameral efforts would benefit patients by increasing treatment options and encouraging future research. We reviewed the IOM report and incorporated those important recommendations into one comprehensive bill. The Stem Cell Therapeutic and Research Act of 2005 reflected a compromise between the key stakeholders that strongly supported establishing public cord blood banks. Our legislation, which became law in December 2005, reauthorized the NMDP and also created a national network of public cord blood banks. The law also provided the ability to search for bone marrow and cord blood units through a single point of access housed by the NMDP. 5 years later, we did it again. Many of the same members of Congress came together to introduce and pass the Stem Cell Therapeutic and Research Act of 2010. All of us working on these bills had one goal in mind: to improve patient access to the best therapies possible. Today, 13 organizations have been awarded National Cord Blood Inventory contracts through HRSA to join the Public Cord Blood Network. Since the passage of the 2005 cord blood law, more than 60,000 high-quality cord blood units have been collected and stored by the NCBI. BI. Cord blood holds promise for an ever-growing list of diseases. Cord blood also is key to the growing fields of cellular therapies and regenerative medicine. However, I know that federal barriers exist for public cord blood banks that could limit or delay access to the most innovative treatments. I want to help you overcome these barriers. I need to hear from CBA members on the best way to accomplish this important task. The bone marrow and cord blood program's authorization expires at the end of this fiscal year. I plan to introduce another cord blood reauthorization bill soon, and Senator Jack Reed of Rhode Island has agreed to be the lead Democrat sponsor. Once again, the House sponsors will be Congressman Chris Smith of New Jersey and Congresswoman Doris Matsui of California. It is in CBA's best interest to present a list of priorities that has been worked out and supported by other stakeholders. That collaborative spirit will help us to introduce the best bill possible. I know that CBA has been working to develop legislative goals with NMDP. Keep talking to each other. I will expect you to be my experts. I will be relying on your professional knowledge and expertise. You have a strong base of advocates who understand the legislative history and the science behind cord blood. I know that I can count on you, and I want to assure you that you can count on me. So friends, thank you again for inviting me to be with you today. I applaud the creation of the CBA and look forward to working with you.